Hi, and welcome back to Focal Point AFR Talk. Brian Fisher is my name. The program is Focal Point. The network is the American Family Radio Talk Network. A story out of the New York Times about the hunt for the uninsured. This is all part of Obama's magic strategy. And this was in the New York Times yesterday. The hunt for the uninsured in Broward County got underway one recent afternoon when 41 canvassers armed with electronic maps on Samsung tablets set off through working-class neighborhoods to peddle the Affordable Care Act door-to-door. 4 hours later, they had made contact with 2,623 residents and signed up exactly 25 people. So that's not just 1 out of 10 that they signed up. That's 1 out of 100. Take 100 times 25, that's 2,500. And they talked to 2,623 residents and only signed up 25 people. You know, and think about what we were told. And so they knocked on all these doors. They could only find 25 people that needed insurance, and they could help them. You know, and remember what we were told. We were being told that people were dying on the streets because they didn't have insurance. We were told that people would flock to Obamacare as soon as it became available. And this is nothing more. We told you about it at the time. This is nothing more than just a make-work project for ex-Obama campaign workers. What are we going to do with these people that worked on this campaign? I got it. We'll pay them to go door-to-door and hack and flack for Obamacare, for Acorn workers, for Planned Parenthood staff, for union members who get untold millions of dollars to do this kind of thing. Meanwhile, here's the story about the fourth hospital in Georgia that has closed due to cuts prescribed by Obamacare. Count them, 4 hospitals in Georgia have closed. Now, you and I are well aware, and let's grab clip number 7. You and I are well aware that Obamacare has cost people jobs. You and I know that for an absolute fact. We know that people have had their hours cut to 29 and a half. We know that people have been laid off so that employers can get down below the threshold so they're not obligated to provide insurance for their employees. Now, here is Kathleen Sebelius. Now, you're about to hear what she's saying. So this woman, if she actually believes what she is telling us, then this is a woman that is capable of self-deception to an alarming degree and is not somebody who should be entrusted with public office. She's disqualified. If she can be this fooled, this deceived, if she's this naive, this gullible, then she doesn't belong in public office. She's a positive menace. If she does not believe what she's saying, then she's a liar, and she's disqualified on the basis of character. Let's listen to Kathleen Sebelius talking about Obamacare and its impact on jobs.
There is absolutely no evidence, and every economist will tell you this, that there is any job loss related to the Affordable Care Act. Part-time positions are actually down since 2010, not up. The number of full-time workers continues to increase. So I know that that's a popular myth that continues to be repeated, but it just is not accurate.
That's Kathleen Sebelius. No evidence whatsoever, despite all the stories we brought you, no evidence whatsoever that there have been any job losses related to Obamacare. You know, and some of that is jobs that are not going to be offered. I mean, we've brought you the statistics about the number of businesses that are just not going to hire. And they're telling surveyors, look, we're not going to, our pollsters, we're not going to hire this year. Or only a small percentage of us are going to hire because of Obamacare. Now, you have all kinds of unintended consequences. Here's a gay couple that's actually suing Obama because Obama canceled their insurance plan. It's a homosexual couple in Ohio. A gay couple in Ohio filed a federal lawsuit on Tuesday charging they were unable to obtain family coverage under President Barack Obama's health care reform law because the state of Ohio does not recognize their same-sex marriage. So Barack Obama is responsible for canceling their health insurance policy. So now they got to go out and buy 3 separate policies, one for each of them, and then they've got a child that they were misguidedly allowed to adopt. And prior to this, they'd been under the same policy for the last 15 years. Barack Obama took it away from them. Now, we've covered stories about the problems that people are having finding coverage, finding doctors, finding hospitals because of Obamacare. Remember, these state exchanges, in order to save money so they can stay afloat, they have had to develop very small networks, very, very tightly constructed networks of doctors and hospitals so that if you sign up with them, you can only go to a doctor or a hospital that is in network. Now, you might have been going to a doctor before, you might have been going to a hospital before, but if they're not in the network that's offered to you through the state exchange, you can't go there anymore. So you can't keep your doctor, you can't keep your insurance plan, you can't keep your hospital. Now, here's a guy, this is a CBS affiliate in Sonora, clip 8, Sonora, California. This is a guy, he's a mechanic, and he's still working. He's got debilitating back pain. He can barely walk. If you watch the video, you'll see him hobble around. And he's an example of a guy now. He needs back surgery, had it scheduled for yesterday, but because of Obamacare, the whole thing is off. Let's listen to his story, CBS 13, Sonora, California.
I would suggest that they contact the plan to make sure of what doctors are available to them.
Well, Tammy says she finally found an in-network doctor, but the problems don't end there. We looked him up using the couple's plan info, and Blue Cross's website shows him as in-network. However, Tammy says the doctor's office told her he won't see patients with insurance from Comer, California.
It's like we're a second-class citizen and we can't get the coverage we need.
To a point where it just feels like I'm just going to end up just being in pain.
So he's just kind of resigned to be in pain for the rest of his life because he can't find anybody that will accept the insurance that President Obama promised him was going to be the best, most extensive policy he could get. You've been paying for junk. I, Barack the Benevolent, am going to provide you with the best possible health insurance, better than anything you've ever had. Now this guy is consigned perhaps to a lifetime of pain. Now, grab clip number 5, if we can. There is a devastating report came out yesterday by the CBO, said exactly what we have been saying to you for years. An increase in the minimum wage puts people out of work. It costs people jobs. And the CBO, remember, this is supposed to be the gold standard. They're nonpartisan. They said if you raise the minimum wage to $10.10, it will put 500,000 people out of work. 500,000 people are going to be out on the street because of Obama, because of an increase in the minimum wage. Now, it'll benefit some people, but it's going to put other people completely out of work. You know, and I use that analogy of an employer that's got 100 units he can spend on labor. That's what he's got in his budget for labor. He's got other costs, but he's got 100 units he can spend on labor. That's all he's got. Well, if people are working for 4 units, then he can hire 25 people. He's got jobs for 25 people, each of them paid 4 units, whatever that is, just using it as an illustration. But he's got 25 people that'll work for 4 units. Government comes in and says, no, now from now on, you got to pay him 5 units. Well, he's only got 100 units he can spend on labor, so now he only has room for 20 jobs. So for those 20 people, yeah, that's good. They get a 20% increase in income. But for the 5 people that are out on the street, it's lethal. It is fatal. Now, here is Gene Sperling, clip number 5. He's President Obama's economic advisor. And so he says, hey, yeah, we understand that this minimum wage increase, it could put people out of work, but hey, this could wind up being a really good thing. Let's listen.
So I think, one of the reasons, and this goes to what David said, where I think there is so much support here, is that it's not going to have an impact on jobs. And it has, and I think it's supported because so many families do see people benefiting. They do see the family struggling to raise their children out above poverty, but they also know what it's like to see a friend, a neighbor, where one spouse goes back to work, who prefer maybe not to work. Maybe they're working part-time just to supplement the family's income, and they think if that family member is making that sacrifice, spending less time with the child, then they should be making a decent living or be able to work less because they're getting a decent wage.
Oh, so we're going to give them an incentive to work less by raising the minimum wage. One last clip, Charles Krauthammer, talking about the fact that the minimum wage, as we've always said, an increase in minimum wage is hardest on the poor. It hurts the people. It claims that it's helping because it moves the bottom rung of the economic ladder out of reach for many, many low-skilled workers. This is what Krauthammer talks about.
That's what this is a transfer of wealth from some low-income earners to other low-income earners. Some, of course, this is so obvious now, rocket science. Some will be better off, will make more, but others are going to lose everything. They're going to lose all of their income, and they're going to lose the first step on the ladder into employment, which is the hope for the future. So it's a high price. You can make your choice, but there isn't a free lunch. They are running ads saying, give America a raise as if it's no cost. It is a cost, and it's other low-income people who will be the ones who pay it.
So it's a transfer of wealth from some low-income folks to other low-income folks. Well, that is it for today. I apologize to those of you that are waiting on line to get in on the phone calls. We devoted a whole segment to it and kind of chewed up more time. I hope you will call back tomorrow. And one other item on the Obamacare thing, there's now a bipartisan effort to scale back regulations under Obamacare that would force restaurants to put nutritional information on their menus, calorie counts and stuff like that. This has already been proven to be a waste of energy. It doesn't work. In fact, when people have calorie counts, a lot of times they eat more, consume more calories than they did before. It's actually counterproductive. Pizza companies that have all kinds of variations and toppings, they would have to produce something like 34 million different schedules of what the nutritional content of your pizza is. Bipartisan, Democrats, Republicans alike don't like it. Don't forget to bow low before God, stand tall before man, stand in the gap, and never forget, ladies and gentlemen, you and I, we're fighting a winnable war. See you tomorrow.
The views and opinions expressed in this broadcast do not necessarily reflect those of the American Family Association or American